Hi everyone, Dr. Callanan here. I'm a naturopathic and functional medicine doctor, and the focus of my practice is metabolic and hormone health. In today's video, we're going to go through some before and after blood work. This is what I review with individuals on a one-on-one consultation, and I want to share with you the progression of this individual. This is a 46-year-old female who's done an amazing job with improving her metabolic health. And we're going to talk about some of the concerns that she's facing now with respect to hair loss and why that might be. So I'm just going to make my video smaller so that you can actually see the blood work here. So the first thing is her white blood cells. It's a marker of her immune system. This looks great. These are all the different types of white blood cells that make up a total. Again, I go through this in slower speed with individuals when we talk one-on-one, and I'm always looking at areas that we can optimize. Now, in terms of her red blood cells and her hemoglobin, we are looking for anemia. So the concern that she has now that she's lost the weight is more so hair loss, and we want to have a look at why that is. Now, when individuals are improving their metabolic health or they're losing weight in general, one of the concerns always is preserving the hair, not stressing the body out too much. And I actually don't think in this patient case, the hair loss is due to the weight loss. And when we're putting patients on a weight loss program, and we're talking a lot about diet and nutrition and how we can resolve things like insulin resistance, better hormone health, we are always repeating the blood work periodically to pick up things like anemia. Are you not getting enough protein? Has your iron gone down? Has your B12 gone down? And this individual, it actually looks great. I have no concerns with her hemoglobin. The size and shapes of her blood cells all look great, so that's wonderful. We've also seen a lot of improvements in her blood glucose. So this is the exact moment that they do the blood draw. Previously, she was 97. Now she's down to 87, which is great. Kidney function there, everything looks great. I'm just going to pick out some of the key ones as we go through this video. Looking at liver enzymes, they were healthy and normal before. They have been reduced, so that's wonderful. Now look at the cholesterol. Her total cholesterol was 282 before. Now she's down to 203, so very close to being within that normal range. That looks fantastic. The triglycerides have significantly reduced. She was almost at 200 before, now at 112, which is fantastic. Her HDL, this is something that's gone down a bit. This is her beneficial cholesterol. We don't want to see that. So what we may want to suggest doing is having more omega-3s in the diet or supplementing with a fish oil supplement. You want your triglycerides and your HDL roughly the same in a 1-to-1 ratio. Now, when the triglycerides are higher than the HDL, this does point to insulin resistance, and that's okay. We've seen significant improvements. We still are working on improving the insulin resistance, and we'll continue to track and monitor this over time. The LDL cholesterol, we've seen significant improvements with this as well with diet and lifestyle. So keeping up a nutrition plan that's high in fiber. And on a one-on-one consultation, we actually go through what is that? What does that actually look like? How much vegetables do you need to be consuming? And one of the fibers called propylamanin fiber is fantastic as a supplement to support the LDL cholesterol as well. Her iron levels look good. We're going to come back to this testosterone piece because there has been some changes to what she's doing with her HRT that I think is not great in terms of having the hair loss, but we'll come back to this. Her thyroid function, this looks good. So when individuals lose weight and they restrict calories, they restrict carbohydrates, if it's too much, we can see that the body begins to compensate or the thyroid function goes down. And this is something that we want to play a close eye on because if you are cutting your calories back too much, you're cutting your protein, you're cutting your carbohydrates, we can see that the thyroid function slows down and you'll hit a weight loss plateau. Now, this individual, her T3s actually went up a little bit. We also have to recognize that there's day-to-day fluctuations in thyroid hormone. Would she feel a little bit better if her T3 was a little bit higher? Perhaps, although it's not outside of the normal range. And I don't think that the thyroid is causing concern with the hair loss. I think it has to do more with the testosterone. Her B12 levels, I personally like to see B12 around 500, so prioritizing red meats, leafy greens. Nutritional yeast is also rich in B12. Folate, so obviously she's consuming a lot of foliage and leafy greens. Her folate levels are greater than 20, which is perfect. Dihydrotestosterone, this is what I call the super testosterone. Your testosterone can be converted to dihydrotestosterone, and this can cause hair loss. And we've actually seen a big jump in her dihydrotestosterone. Every single individual will have a different tolerance or a different sensitivity to androgens. Androgens are the quote unquote male hormones like testosterone, DHEA, dihydrotestosterone. So we've seen this increased, and we're going to talk about why that is. Her hemoglobin A1C, she's now within the normal range. She's no longer pre-diabetic, so she's doing fantastic. DHEA looks good. Cortisol levels, cortisol is our stress hormone. It's particularly challenging to accurately get a good idea of cortisol on blood work. It's better to do a saliva sample or a urine sample where we can do that multiple times a day because cortisol follows a rhythm. Cortisol should be high in the morning and go down before bed. So if we just look at the morning cortisol, we're not always getting the full picture. So if stress is a contributing factor for her, we might consider some more in-depth testing. In terms of her hormones, so this individual is utilizing hormone replacement therapy, and we want to have a look at why is her testosterone so high. I think this is where her hair loss is coming from. Now, this individual had decided to do pellet therapy for testosterone. I think pellet therapy can create the wow factor, but it also carries more risks of exactly what we're seeing for hair loss. In terms of how high her testosterone is, she is greatly outside the normal physiological range. Now, I don't think it's great to push females' testosterone this high. There are some practices and practitioners that don't mind higher amounts of testosterone, but because I see so many side effects in doing this in terms of hair loss, I think this is going to be a problem for her moving forward long term. The other issue with pellet therapy is the higher dose of testosterone that you give a patient, what we're going to see is a rise in sex hormone binding globulin. And sex hormone binding globulin is like the catcher's mitt that binds onto hormones to make them inactive and move them around the body. So what happens that I often see with pellet therapy is you have this initial dose of testosterone, you feel really good, and then all of a sudden your sex hormone binding globulin rises to bind it back up. So in order to get that same wow effect, you're looking at higher and higher and higher dosages of pellet therapy. Now, this is her level before she gets her next pellet. So she's sitting at 177 for total testosterone and 27 for free testosterone. And this is essentially supposed to be her lowest point before getting the next pellet. I see some individuals really like testosterone replacement therapy and pellet therapy. I'm not a huge fan of it because we run into situations like this where she feels good, but she's seeing hair loss. So we're going to need to come up with a plan that's going to be suited for her where we can look at how can we perhaps reduce your levels of testosterone where you still get benefits with it, you still feel the benefits of testosterone replacement therapy, but it's not so high that we're seeing issues. Now, we have not established upper reference ranges for females in terms of utilizing hormone replacement therapy because not a lot of research and we haven't done a lot of testing and studies on this, but just because an upper physiological or an upper range hasn't been established does not necessarily mean that it's safe just to give higher and higher dosages. So I think this is exactly why she's experiencing the hair loss, and this is going to be the problem that you run into when you do pellet therapy. Other hormone levels, we'll chat about that one-on-one in our visit. Her vitamin D, significantly better. Her C-reactive protein, a marker of inflammation, this has gotten significantly better. So her overall risk of cardiovascular disease has significantly reduced by lowering her cholesterol, lowering her LDL, lowering her inflammatory markers, as well as no longer being in that pre-diabetic range. Her hair loss is not coming from Hashimoto's. Her thyroid antibodies are not elevated. Her insulin's getting a lot better, and her ferritin is great. It's over 100. So this gives you a little bit of a quick rapid fire with respect to how I review things with individuals, what we chat about. She has done amazing in terms of reducing her overall risk of chronic disease. Blood sugar's better, inflammation's better. Everything is looking really great. I don't think it's the weight loss, the significant weight loss that she's seen that's causing the hair loss. I think unfortunately it's due to the pellet therapy, but we're going to chat more and come up with a next step for her. And this is just to give you a little bit of caution when you're looking at testosterone replacement therapy. It's not all forms of testosterone replacement therapy, but I just think the pellets and the dosaging sometimes that we're using is way overdoing it.